When we talk about Georgia being the top state in terms of new HIV diagnoses, a lot of policymakers may want to help with mitigating the HIV epidemic, especially in the South, but they just don't have the information.
Southern AIDS Coalition was founded over 20 years ago. Advocates came together, public health leaders, community leaders, people living with HIV to create SAC. We recognize that we can't address the needs related to communities living with and impacted by HIV if we're not working in partnership with our elected officials, administrative policymakers, anyone who's making decisions that can impact one's access to health, resources, all the things that allow someone to thrive in the South.
It is very clear that the Southern AIDS Coalition has a campaign around letting folks' voices be heard. So we're excited to be a part of the stigma-busting group of legislators who have come to Atlanta to say, we hear you.
We in America, we have this idea that you criminalize what we should be actually helping to work towards fixing. You can't criminalize a public health crisis, but we have to humanize this.
The policymaker is really essential in making sure that we have thoughtful policies and frameworks that allow people to receive services where they can access them with flexibilities and limited restrictions, such as removing prior authorizations and other barriers that make it harder for people to access PrEP.
Policymakers and healthcare providers need to be talking more, because if policymakers don't have that information about what's going on the ground, how are they supposed to make any change or impact? And how are we supposed to hold them accountable?
Policymakers, it's our responsibility to make sure that we are listening to the community, hearing those voices, make sure that we are touched by those stories.
So as we move forward, I would like to see this conversation taking place in a less political way so that we can get the good work done that we need to see.
I would really like to see more coordination between organizations, coalitions, groups that are committed to ending health disparities, and HIV being a part of those conversations. The more people are talking openly about HIV and access to HIV prevention tools, then the closer we get to ending the HIV epidemic for everyone.